Hello and welcome to our Future Foundation Global booth. It is a beautiful day here in CSM Anaheim. We are at booth 1732, and today I am joined by Ellen Anderson. Ellen is an international speaker in physical activity and wellness for people with chronic conditions, including those with mental health challenges and intellectual disabilities. Ellen is a Special Olympics Global Advisor for young athletes, a co-owner of Yogi Anatomy and PTCannabis.info, and a passionate advocate for whole person mental health in physical therapy. Ellen, welcome to the show.
Thank you so much, Ben. It's great to be here.
So, just in case there's lots of awesome stuff about you that I didn't cover yet, what sparks your passion still about physical therapy to this day?
What I like about physical therapy, what I love about physical therapy is that I think we can embody that whole person care concept. And whole person care has been talked about for decades. I believe that physical therapy and physical therapists is the one group and discipline who has been incorporating whole person care into our practice almost from the very beginning. Now, that's not to give short shrift to occupational therapists who are very similarly minded, but that's what I love about physical therapy.
Right. So we're going to really delve into the mental health space, right? What I really appreciate is, why is mental health now such an important part of physical therapy practice? And now, how does a whole person approach maybe possibly improve outcomes for individuals and communities?
Right. So if we think about the whole person approach, what we need to consider is, what is the family involvement? What has been the birth history and the trajectory of wellness? What is the cultural mindset of health? What is the explanatory model of health, right? All of those things come into play when we're talking about whole person care. Well, mental health, mental well-being comes from that model. But what we now know from science is that we cannot separate mind from body. And so what happens is our mind can affect our body. If you were giving a lecture this morning like I was, and you had a little bit of butterflies in your stomach, that's the emotion creating an effect in the body. Well, the body, the aches and pains, the, oh my gosh, I don't know, my heart rate's going up, is that a good thing or a bad thing? For physical therapists, we can explain that physiological change and see how it gets expressed in emotion. But there are a lot of patients, a lot of people who experience these somatic changes in their body. It's related to their emotion, but they don't know it.
Correct.
And so it goes both ways, and we can't separate the two.
If I care about ACL function, if I care about the mobility of the AC joint,
Right.
I think we all should be keeping an eye, at least have a rudimentary understanding of the mental health needs of our patients.
Well, and you bring up a really big topic, right? Because ACL injury is happening to a lot of individuals, but many outpatient physical therapists like yourself are seeing that in young athletes, in athletes that are at a critical part in their career. And what does that do to them psychologically? The psychological investment into rehabilitation, but we have also learned that there's an element of fear about, what if I can't get back? And maybe, what if I don't want to experience an injury like this again? Of course, that's going to affect the rehabilitation process.
So, yes, the STAR test, but also pay attention to your patient's well-being, right?
Absolutely.
All right. Along that topic, what can you tell us about the APTA Academy of Leadership and Innovation's Physical Therapy in Mental Health Catalyst Group?
Yeah.
And why it matters even more so today?
Okay. So the Catalyst Group was started because there are many like-minded physical therapists who know that on a regular basis, every day, every patient, they're taking into account their patient's mental health and well-being. They know that connection, and because they're clinicians like you, they automatically see how both mental health and physical health go hand in hand, right? You can't have physical health without good mental health. And so that idea has not necessarily been embraced by all physical therapists, because there's some concern about this is not my practice act. I didn't get trained in this in school, like all those kinds of things. But we want to promote that there are consistent examples across practice setting and across patient population. So just as you described an example in sport, we have that in pediatrics. We have mental health concerns in geriatrics. We have, the mental health aspects to rehabilitation post-stroke with the diagnosis of, you get diagnosed, right, with MS or ALS. You mean to tell me there's not a psychological
Right.
health
You're only worried about your central nervous system without the psychology of the human.
Exactly. And so by creating this catalyst group in the Academy of Leadership and Innovation, we transcend all the academies. We feel as though we can reach people who are interested in this topic, regardless of whether they're part of pediatrics, geriatrics, orthopedic sports.
That is wonderful. Because I'm going to tell you, like a Filipino IAPT lens, for many Filipinos, internationally educated PTs, Asian cultures, mental health, I'm allowed to say that because I'm Asian, right?
Okay.
Mental health was not historically part of our professional language or training culture, and I'll argue even in some parts of the Western world at certain times.
Totally.
We're getting better now. So now what I'm seeing, which I'm very happy about, is we're seeing a shift, especially among early career PTs who are IPTs, with a growing interest about burnout, mental well-being, and whole person care. How do you think the mental health catalyst group can practically be a safe and welcoming space for these clinicians to explore mental health topics, build confidence, and contribute their perspectives?
Yes. So what we've been doing over the past year or so, and even more so in the past few months, is to call upon professionals, if they are remotely interested in PT mental health, to share their clinical experience and to volunteer to participate in little webinars or develop little educational bites for us to be able to say, hey, mental health concerns can be addressed in these different settings. What always comes up whenever we pool the audience or have a town hall meeting is, well, what about the clinician? And we, of course, need to acknowledge that, particularly post-COVID, we've seen an uptick in people leaving the profession and people moving to non-clinical positions. And a large part of that has to do with not just mental health, but burnout as its own entity. And when we look at burnout with a capital B, I'm not just burnt out and exhausted, but we look at it with a capital B, it's about the individual's reaction to what's happening to the system that they work in. And I think when we take it from that perspective, that it's not all about the individual. We're not blaming the worker. We're not blaming
systems. The systems problem. Don't say that too loud.
We need to incorporate the other aspects. And I think physical therapists maybe feel a little more comfortable about talking about that if nobody's going to wag their finger and say, just do a little more yoga, Ben.
Yeah, so here's some pizza for you, all right?
Exactly.
I'm so glad that we are now doing more on this space. Now, if I could ask you, if there's one step that our colleagues could do so they can, take care of their mental health or burnout and whole person care in physical therapy, what would you ask them to do?
Oh boy, I think that's a very individual thing. However, I think my general
The Ellen Anderson answer.
I think my general approach is to stop and breathe. And so that simple technique, whether you're walking into your boss's office or whether a patient has just dumped on you a lot of emotional drama, or whether you are getting frustrated with your children, if you can not react in the moment, if you can stop, take a breath, and then decide how to proceed, it's not only helping the people that you're with, but it's helping you.
Stop and breathe.
Stop and breathe.
Do not confuse simple with easy.
Exactly.
Do not confuse, but yes, in its simplicity, it is so helpful.
Okay.
So, Ellen, thank you so much for your time.
You're welcome.
I want to end this interview with one question. We are in CSM Anaheim.
Yes.
Disneyland is about, 50 meters that away.
Yes.
If you had to be one Disney PT or PTA character, who would you be?
Oh my gosh, that is such a tough question. I don't even really know.
What, do you think it's going to be a cakewalk because we're friends? No, I got to throw it at
I don't
you.
even really know who Disney characters. You know what? Pocahontas.
Pocahontas. Okay, any particular interesting why Pocahontas?
I think because even though some people might think of me as a princess, I don't think of myself as a princess.
How about bridging cultures? That is you. You are very interested in other people's cultures.
And-
from what I know about you.
And I like strong, independent women, and I think Pocahontas.
Who doesn't like strong, independent women?
You're so evolved.
Yes, yes.
And your love is Maria, so
Yes.
you have to.
I have to, for my sake.
That's right.
Once again, ladies and gentlemen, coming from the FFG booth, we'd like to thank Ellen Anderson for spending time with us. And thank you. And please keep an eye out for her mental health and physical therapy calendar.
Excellent. Thank you so much, Ben.
Thank you so much.
I appreciate it.
Thank you.